No pain does not mean no problem. Fatty liver often hides in silence, and 5 early signs can bring it into view. Many people feel well while mild changes begin inside the liver. That is why a clear map of early clues and simple next steps matters so much for adults over 50. In this video, we will outline the 5 warning signs, explain their physiological implications, and provide a focused plan to take action on time. Please subscribe so you never miss practical, doctor-guided lessons for life over 50. Before we get specific, it helps to know exactly how to work through this information without guessing. Here is how to use this guide without any guesswork. First, scan the 5 warning signs and circle any that match your experience. Next, use the simple test list to check where you stand. Then choose 2 actions that fit your life this week. We will keep the language steady and clear, and we will build from the cell level up so each choice makes sense. With that roadmap in place, begin with the early clue that people most often overlook. First, a persistent tiredness that feels deeper than your usual end-of-day fatigue can be an early clue when other causes are not present. Fatigue has many roots after 50, including low mood, poor sleep, thyroid imbalance, anemia, side effects of medicines, and deconditioning. In fatty liver, the pattern often feels like a general slowdown that peaks after meals heavy in sugar and refined starch. Inside the liver cells, extra fat crowds the tiny power plants that handle energy, so output drops. Day after day, this shows up as afternoon energy dips and a pull toward quick snacks or extra caffeine. If that picture fits and there is no clear reason, treat it as a prompt to ask for liver and metabolic blood work. Once you understand how tiredness can hint at trouble, notice whether your body is sending a subtle physical signal in one specific spot. Second, a sense of fullness or a vague heaviness under the right rib cage may appear, especially after larger meals. The liver sits under the right ribs and is wrapped in a sensitive capsule. As fat accumulates in liver cells, the organ can enlarge slightly and the capsule can stretch. The feeling is not sharp. It is a dull, pressurized awareness that you may notice when sitting, bending, or after late meals. Many people with fatty liver feel nothing there at all, so the absence of this sensation does not reassure. If a new, vague fullness lingers for weeks, raise it at your next visit so your clinician can examine, order basic blood tests, and consider non-invasive imaging. From sensations, shift your attention to a visible change that often shows up before a number on the scale moves. Third, a waist that inches outward while the scale barely moves is a red flag worth noticing. Central fat behaves differently from fat under the skin. It sends signals that keep blood sugar and blood fats higher and push the liver toward making and storing more fat. Belts move a notch, pants tighten at the waist. This is biology, not blame. The body shifts toward storing energy near organs rather than under the skin, and the liver sits in the middle of that traffic. When your waist grows without a clear reason, log it as a data point that deserves attention. After you note shape changes, check the most objective clues you can get without guesswork. Fourth, changes in routine blood tests are often the first objective sign, long before symptoms. Mild elevations in alanine aminotransferase and aspartate aminotransferase can reflect liver cell stress. Gamma-glutamyl transferase can increase with metabolic stress and with alcohol. Fasting sugar can creep upward and blood fats can rise. No single test proves fatty liver, and normal numbers do not rule it out. Still, for adults over 50, a yearly panel offers a quiet window into liver and metabolic health. When results stray above the desirable range, your clinician may repeat the panel, review medicines that can stress the liver, and add an ultrasound or a non-invasive stiffness test to check for extra fat or early scarring. Numbers tell part of the story, yet sometimes the mirror speaks even sooner. Fifth, skin changes that point toward insulin resistance can be clues you see in the mirror. Acanthosis nigricans describes soft, dark, velvety patches on the neck, in the armpits, or under the breasts. These patches are not dangerous themselves. They signal that insulin is running higher than it should to balance blood sugar. High insulin also drives fat making in the liver. If these patches appear alongside a growing waist or rising fasting sugar, pair those findings and ask for a full metabolic review. To understand why these clues cluster, it helps to watch what the liver is doing underneath. Now map what is happening inside the liver so each warning sign makes sense. The liver is not a passive storehouse. When meals and snacks are dominated by sugar and refined starch, the liver shifts into fat production mode, a process known as new fat making. Stress hormones, short sleep, and long hours of sitting amplify that signal. Fat from the diet and fat released from your own fat cells also flows to the liver. Over time, more fat enters than leaves. The tiny engines within each liver cell work harder and produce more byproducts that strain the cell. Immune cells gather, and in some people, inflammation develops around the swollen fat cells. If that continues, the cells that build scar tissue begin laying down fibers. That is the pathway from simple fat accumulation to inflammation and then to scarring. Those pathways exist at any age, yet biology after 50 can tilt them further and faster. Age changes the playing field, which is why the risk rises after 50. Muscle tends to decline unless you protect it, and less muscle means fewer places to burn energy. Hormone patterns shift, sleep can become lighter and more fragmented, and medicines for common conditions can change appetite and metabolism. Gut bacteria drift in composition with age and diet. The liver sits at the crossroads of these changes, processing what the gut absorbs and responding to body signals. That is why liver care belongs on the same list as eye checks and hearing checks after 50. If nothing interrupts this drift, the course usually follows a familiar arc. If we let the process run, here is the typical path. Fat alone can sit quietly in the liver for years, and many people stabilize or improve with simple changes. In a subset, ongoing stress triggers inflammation. Inflammation invites scar-building cells to lay down fibers. Scar can remain mild, or it can bridge across the organ and change its structure. Pressures can rise in nearby veins. Over long time frames, complications can develop. Early action interrupts this chain while change is still easy. Because different forces can produce similar findings, a quick safety screen prevents missed contributors. Different pathways can lead to similar liver findings, so a quick screen for secondary causes protects you. Alcohol can contribute to some people. Medicines such as amiodarin, tamoxifen, methotrexate, and some steroids can stress the liver. Rapid weight gain or crash dieting can swing fat handling in ways that burden the liver. Untreated sleep apnea worsens insulin resistance. A thyroid imbalance can confuse metabolism. Share a complete list of prescription drugs, over-the-counter products, and herbal supplements at your visit. If you take blood thinners, seizure medicines, immune-modulating drugs, or heart rhythm medicines, never change doses on your own. Work with your clinician to weigh risks and benefits. Once you have ruled in and ruled out the big drivers, the evaluation can stay simple and calm. A simple, stepwise evaluation keeps this focused and calm. Ask for a visit dedicated to early detection and prevention. A good exam looks at blood pressure patterns, central weight gain, and any tenderness under the right ribs, and it checks the skin for insulin resistance patches. Basic tests include a complete blood count, kidney and liver panels, fasting sugar and insulin if available, and a cholesterol profile. If numbers suggest stress, an ultrasound can check for fat. If scarring is a concern, non-invasive tools can estimate stiffness and risk. Simple calculators that include age, platelets, and liver enzymes can help triage without complexity. With a clear starting point, you can move from knowing to doing. With the warning signs on the board, a 12-week plan gives you a realistic start. A gentle, steady weight loss of about 7 to 10% of starting weight over months, not weeks, lowers liver fat, quiets inflammation, and reduces scarring risk. If your weight is already in a healthy range, you can improve liver fat by changing where your calories come from and how your day is structured. The liver responds to patterns, not perfection. Food is the first lever, so build meals that keep blood sugar steady. Build meals that steady blood sugar and reduce new fat making inside the liver. Anchor breakfast with protein and fiber. Eggs with a generous pile of vegetables and a slice of whole grain toast, or plain yogurt with berries and ground flax or chia, are simple starts. For lunch and dinner, lead with fish, poultry, beans, or tofu. Add a large serving of colorful vegetables, include fruit, and add a modest portion of whole grains or starchy vegetables if you enjoy them. Use nuts or olive oil for healthy fats, save sweets for special moments, not for daily habits. Replace sugary drinks with water, unsweetened tea, or coffee without heavy sugar. Liquid sugar is a quiet driver of liver fat. Since many people ask about beverages, one common question deserves a clear answer. If coffee agrees with you, 2 to 3 cups without heavy sugar can be part of a liver-friendly day. Coffee contains compounds that support antioxidant defenses within liver cells. If you live with reflux, anxiety, heart rhythm problems, or insomnia, discuss coffee with your clinician and adjust. If you do not like coffee, there is no need to begin. Nutrition works best when the muscle is doing its job, so movement comes next. Your muscles are your metabolic shield, so movement is non-negotiable for liver health. The liver cannot clear extra fat alone. Muscle tissue is the main sink for energy. Preserve and rebuild muscle after 50 with a mix of walking and strength training. Start with short, regular walks and add 2 or 3 strength sessions each week. Chair sit-to stands, wall push-ups, and band rows are joint-friendly options. If you have heart disease, significant joint pain, or balance concerns, ask for a tailored plan from a physical therapist. Movement improves insulin sensitivity within days and builds reserve over weeks. To lock in those gains, restore the nightly rhythm that metabolism depends on. Sleep and stress shape liver biology every day, so restore the nightly rhythm first. Short or fragmented sleep pushes appetite toward fast energy foods and worsens insulin sensitivity. Choose a consistent bedtime, dim lights in the hour before sleep, and keep phones away from the bed. Avoid heavy late meals. If snoring is loud or you wake unrefreshed with headaches or dry mouth, ask about a sleep apnea evaluation. Treating sleep apnea reduces metabolic stress on the liver and benefits heart and brain health. There is also one liquid that needs a clear plan because the liver handles every drop. Alcohol needs a clear, honest plan because the liver must process every drop. Even moderate intake can raise liver enzymes and increase fat in some people. If your tests are repeatedly abnormal, if stiffness tests suggest scarring, or if you take medicines that stress the liver, the safest limit may be 0. If cutting back is difficult, ask for support. Modern behavioral and medical tools help many adults reduce or stop alcohol use. Avoid combining alcohol with higher daily doses of acetaminophen, which can increase risk. Habits matter, and so do the products in your cabinet, which is why a review is part of care. A medicine and supplement review is a core part of liver care, not an optional extra. Common pain relievers, sleep aids, and herbal blends can add quite a strain. High-dose vitamin A, kava, and some bodybuilding supplements have been linked to liver injury. The fix is transparency and monitoring, not fear. Bring bottles or clear photos to your visit. If a necessary medicine can stress the liver, your clinician can set up regular tests to keep you safe. Never stop a prescription on your own, especially those that prevent stroke, seizure, heart attack, or autoimmune flares. When these pieces come together, you can expect the first improvements sooner than you might think. Expect early wins within weeks, then watch them compound over months. Into 2 for weeks, many people notice steadier afternoon energy and a small drop in waist size. In 3 months, liver enzymes often move closer to the desirable range. In 6 months, body composition shifts become visible and the new routines feel natural. These time frames are common but not guaranteed. Progress can be slower and still be deeply worthwhile because the same habits protect your heart, brain, joints, mood, and sleep. As you improve, keep an eye on the few signs that call for extra testing or a referral. Know when to ask for more testing or a specialist so you do not miss higher risk. If liver enzymes remain well above the desirable range for 3 months despite early changes, imaging is reasonable. If calculators or stiffness tests suggest a higher scarring risk, ask for a referral. If you carry several strong risks together, such as type 2 diabetes, central obesity, and high blood pressure, early specialist input can help set priorities. If you notice yellowing of the eyes or skin, dark urine, pale stools, new swelling of the belly or legs, confusion, or profound sleepiness, seek urgent care. Those are late warnings that need immediate attention. To keep momentum and make progress visible, map out the next 90 days. Use this practical 12-week blueprint to move from intention to action. Weeks 1 and 2, keep a simple log of meals, drinks, sleep, steps, and medicines without judgment. Weeks 3 and 4, make 2 food swaps that feel easy, such as replacing sweet drinks with water and anchoring breakfast with protein and fiber. Weeks 5 and 6, add a regular walking routine and 2 brief strength sessions each week. Weeks 7 and 8, reduce late-night eating and lower alcohol if you drink. Weeks 9 through 12, review medicines and supplements with your clinician, repeat tests, record early wins, and adjust. For many people, body weight is part of the story, so approach it in a way that protects muscle. If weight loss is appropriate for you, choose a gentle target and protect muscle as you go. Crash dieting increases stress and invites muscle loss. Aim for slow change, with steady protein intake from beans, lentils, eggs, fish, poultry, tofu, and Greek-style yogurt. If you have chronic kidney disease, ask for personalized protein targets. If you have diabetes and take medicines that can cause low sugar, plan ahead with your clinician so doses can be adjusted safely as your diet changes. If pain is limiting your movement, there are still safe ways to build strength and stamina. Joint pain does not need to block progress because movement can be adapted to your body. Pool walking, cycling, or chair-based strength sessions can build muscle without overloading painful joints. Pain can be managed with topical treatments, gentle heat, careful use of oral medicines, and targeted injections when appropriate. Protecting movement protects your liver and your independence. Real life also includes restaurants, celebrations, and family meals, so set up guardrails you can live with. Social meals can stay joyful without derailing your plan when you set the table for success. In restaurants, build your plate around protein and 2 vegetables, ask for sauces on the side, and share desserts. At home, keep fruit and nuts in plain sight and place sweets out of sight. Environment beats willpower. Small position changes in your kitchen and pantry lead to fewer decisions and better outcomes, while you shape meals, treat add-ons, and wellness products with the same care you give prescriptions. Be thoughtful with herbal products and wellness trends because natural does not always mean safe. Some plants are gentle and useful. Others burden the liver or interact with prescriptions. Green tea as a drink is fine for many people. Concentrated extracts in capsules can be another story. Share details with your care team so they can scan for risk. There is one safe addition most people benefit from, and it supports the liver through the gut. Fiber is your quiet ally because the gut and the liver work as partners all day long. Fiber slows the blood sugar rise after meals and feeds beneficial gut bacteria that produce compounds your liver likes. Most people thrive on vegetables, fruit, beans, lentils, nuts, and whole grains. Increase fiber gradually and drink water throughout the day. If you live with irritable bowel symptoms, select gentler fibers and advance step by step. As you change, track the few measures that truly reflect better health. Measure what matters so progress feels encouraging, not punishing. Weigh once a week in the morning after using the bathroom. Measure your waist at the belly button weekly. Track how many days you met your movement plan and your alcohol plan if you drink. Note afternoon energy. These simple metrics show the story better than daily scale swings. Support makes those numbers move, so build a small circle that keeps you going. Accountability turns good intentions into steady habits. Invite a partner, friend, or neighbor to join your walks. Share one weekly goal. Celebrate small wins. If you like technology, a basic step counter helps. If you prefer paper, a small notebook works just as well. The tool matters less than the routine. Your experience also helps others stay on track, so add your voice. Your voice helps this community learn together, so please share one quiet sign you noticed and what you plan to change first. Comments guide the next sessions and often give another person the nudge they need. I read them, and I will continue to shape future lessons around your needs. If habits alone are not enough, there are medical tools that can support your plan. In some cases, medicines that target weight and blood sugar can support the plan you are building. People with long-standing insulin resistance, high fasting sugar, or type 2 diabetes may benefit from medicines that improve insulin sensitivity or help with weight loss under supervision. These can reduce liver fat and improve tests. They are tools that work best alongside daily habits. If you have heart disease, kidney disease, or other conditions, your clinician will help choose safe options or advise that lifestyle remains the best path for now. Beyond medicines, prevention keeps you safer while the liver heals. Vaccinations and age-appropriate cancer screening play a quiet but important role when the liver has been under stress. Ask about immunity to hepatitis A and hepatitis B, and about vaccination if you are not immune. Keep up with colon screening, breast screening, and prostate screening according to your age and risk. A healthier liver supports every other system, and those systems support the liver in return. Hold a kind mindset as you work, because that is what allows change to last. Perfection is not required for healing, and that single belief unlocks progress. Health is the average of your patterns, not the worst day of your month. If a week goes sideways, begin again with the next meal and the next walk. Your liver responds to steady, kind care over time. As changes add up, keep safety in view so that gains are not lost to avoidable issues. Safety comes first at every step so that your plan builds health without new problems. If you take warfarin or other blood thinners, do not start or stop herbal products without guidance. If you live with chronic kidney disease, avoid extremely high protein plans and ask for personalized targets. If reflux is a frequent issue, choose gentler drinks and lighter evening meals. If pain has you reaching for daily anti-inflammatory pills, ask about safer options, because high daily use can stress the kidneys and stomach. If your eyes or skin turn yellow, if urine turns dark or stools turn very pale, or if new swelling or confusion appears, seek urgent care. To see how the pieces fit together, try a simple week that you can repeat. A one-week starter schedule shows how these ideas look in real life without turning your life upside down. On Sunday, sketch 3 breakfasts that anchor your day. On Monday, walk for 10 minutes after 2 meals. On Tuesday, do 3 sets of sit-to-stand and 3 short sets of wall push-ups. On Wednesday, prep a tray of chopped vegetables and fruit so healthy choices are easy when you are tired. On Thursday, replace 1 sweet drink with water. On Friday, cook a simple fish or bean dinner with a large salad. On Saturday, enjoy a special dessert slowly and share it. This is not a diet. It is a gentle turn toward a life your liver prefers. Now distill the plan into one short list you can post on your fridge. Your action plan is short, so you will do it and stick with it. Identify 1 warning sign and schedule tests if due. Replace 1 sweet drink each day. Walk after 2 meals most days. Add 2 brief strength sessions weekly. Anchor breakfast with protein and fiber. Set alcohol to a safe limit or remove it if advised. Review medicines and supplements with your clinician. Repeat tests in 3 months to see the story in numbers. Adjust and keep going. Before we wrap, your perspective matters to this community, and your note may help someone else begin. Tell me which of the 5 signs you will check this week and the 1 small change that feels realistic for you. I read your comments, and I will continue to build future lessons around your needs. If this helped you, please subscribe so that you do not miss the next session, and share it with someone you care about.